Well, hello everybody, and welcome. I appreciate everybody tuning in. We have a special guest with us today, Ruthanne Morrow. Ruthanne is a nurse practitioner. She was also a Navy trauma nurse, deployed into Afghanistan, served our country over there. We thank you for your service, Ruthanne. We thank you for your time being on this, and so I just want to give everybody a minute to log in and begin watching. So today we're going to be talking about just some practical discussion around the COVID-19. We're gonna talk about some common sense ways to react to it, and I'm gonna get Ruthanne's opinion on a few things, and we certainly welcome questions and comments. So we would love to hear from you guys on what on your thoughts and ideas or questions that you might have for somebody from the medical profession. So Ruthanne, thank you for being here.
Thanks for having me. I look forward to, sharing any information I can to everybody. Thanks for ARA for having me.
Cool. Well, absolutely. So I want to jump right in and talk about a couple of things. There was a lot of guessing going around at the beginning of the pandemic, and there was a lot of how should we handle it? Should we? Obviously, now we're all almost everybody is in a state of shelter in place. We've spent the last several weeks ironing out what is essential businesses versus non-essential businesses, and but should we wear a mask when we go outside? Should we not wear a mask when we go outside? So there was a lot of questions, and we saw our leaders and professionals scrambling to come up with answers, and sometimes even changing those answers. So I'm just curious and of your opinion of why there seemed to be so much guessing going on. But before I do, I want to make sure it's clear to everybody watching, and I want Ruthanne to kind of tell us in her own words, what Ruthanne is going to share with us are her opinions. So I just want you to go ahead and expand on that for us, Ruthanne.
Yeah, well, first, just in case you don't know what a nurse practitioner is, I was a trauma nurse for many years, and I went back to school. I became what we call an advanced practice provider. So a nurse practitioner is someone who can diagnose illness, treat illness, prescribe medication, prescribe therapy such as PT, OT, prescribe imaging like CT scans, MRIs, and basically we can do a lot of things to take care of the whole patient. So that's kind of what a nurse practitioner is, and that's kind of how it differs from my previous role as a registered nurse. But to answer the question why there was so much, and I'm not claiming to be an expert here. And I'm not claiming to represent all nurse practitioners around the entire world. So that's frankly, it's my legal disclaimer. Don't sue me. These are my personal opinions that I'm sharing with you all today. To answer your question about the scramble and the confusion at the beginning of all of this and why the story just keeps changing and evolving, I think is because this is a novel virus. And when we say novel virus, we mean this is the first virus of its kind ever known to mankind. There's not been one person who's ever had it before. So when we look at how to handle and treat a novel virus, we have no precedence for it. Like with influenza or Ebola or some of the other viruses, they've been around for a while. We know how to treat them. We know the patterns. We know the symptoms of them. When coronavirus first showed up, possibly early December, again, nobody really even knows when it first actually showed up. Nobody really knew the symptoms. We didn't know how it was transmitted. We didn't know the incubation, meaning if I have the coronavirus, the incubation is how long does the virus sit in a person before they get symptomatic? There were so many questions about it that people just didn't know. We didn't even know if it would actually leave China and become a pandemic. So there's so much information that people didn't know because it was a novel virus. So that's why you see the scramble. That's why you see these models that didn't really seem to make sense, because there's never been a virus how can you create a model that actually will work and give really good data if it's never been done before? If you've never had a chance to replicate it and test it, how do you know it's a good model? You don't. You basically have the most brilliant minds in the world giving their scientific guesses, their hypotheses of how something is going to roll out. And right now we're in the experimental phase of it. It's rolling out, things change, and we won't actually know how good of a job we did or what it even looks like until, you know, the virus kind of plays out to a completion. And the last 2 months, the whole world has just been learning more and more and more about an unknown virus. And I think it's also good to mention that there's not one living person in the entire world who has ever managed a global pandemic. The last time we had a global pandemic was the influenza pandemic over 100 years ago. So 100 years ago, there was no air travel. People didn't go to, London for the weekend. They didn't go see a Broadway play in New York City on the weekend. We didn't have the travel, so there wasn't the transmissibility globally. So the whole country is basically going through, or the whole world is going through something that no one's ever seen before. So that's why you have uncertainty. That's why things change. These models started off, first our models started off and we didn't even know if we were using the right models, because you kind of just don't know because it's never happened before. And you're plugging, when they first started using the models, they were starting off with like zero data or just data coming out of China. And then as more people get sick, more cities and countries and people are infected, you collect more data, you plug it into the model changes. More data, it changes everything. Sure. So that's why there was a lot of scramble at the beginning, because there were just so many questions and so much uncertainty.
So what do you think the data tells us? Do you have any idea on whether or not we should expect this to hit us again towards the end of this year? And I know that's kind of a left field, because Ruthie and I had a discussion. I do this, right? We have a discussion and we have all these issues, but I told her people were going to pop in questions. So this is one we didn't talk about. So it's kind of a left field, but can you speak to it?
There's a really high chance that it'll happen again in the fall. There's a lot of speculation that it's going to be similar to the influenza virus, where we see it seasonally. But it's possible that if as people get antibodies and so on and so forth built up in their immune system, that it may not be as bad or severe. But I think that in 5 years, we'll have a really good answer for that question.
Right. So you talked about antibodies. Tell me how important is antibody testing? What is it, and how will it help us?
Okay, well, first, an antibody is something that is when your body builds an immunity towards something. Say you had the measles as a child, or you got the measles vaccine, your body built antibodies as an immune response to that disease. So then you can never get measles again. So the antibody testing will tell us yes or no. It's a blood test, and it'll tell us yes or no. This person has antibodies for coronavirus. They can't get coronavirus again, or you don't have antibodies and you're susceptible to it. So the antibodies will the antibody testing gives us a good idea of how covered is our population as a whole, and who our vulnerable population is, who doesn't have antibodies and who does. So that's why it's important, because it also lets us, antibody testing will also be helpful if we develop a vaccine in the future. Antibody testing is one way that we know if the vaccine was effective or not.
Sure, that's important.
No antibodies, no immunity.
Right. So a week or two ago, maybe a couple of weeks ago, the CDC kind of shifted their position on face masks in public. First they said don't do it, or they didn't say don't do it. They said it's unnecessary, and now they're advising that we should wear face masks in public. So full disclosure for people watching, I'm going to tell a quick story. Ruthie, for those of you who don't know, is is the wife of our first past president, John Morrow, and they live in the same town I live in Fredericksburg, Virginia. I saw Ruthie at the grocery store about 2 weeks ago. It was not long after they switched their position and advised to wear face masks. And Ruthie was in the grocery store. She had a face mask on, and I was standing a good bit away from her. And I said, "Hey, how you doing?" She said, "Good." And at the time, you were probably one of the only people in the store wearing a face mask. It had not taken off the way it has now. And you hollered from across the way. You go, "I'm wearing a face mask because I'm treating COVID patients at the hospital." And I don't know if you noticed, but about 5 people turned around and looked at you.
Oh, I had no idea everybody looked at me.
I forgot. I never told you.
I might as well have had plague written on my forehead.
Yeah, no. But anyway, my question is, face masks. Are these, so they're advising we do it. You're seeing more and more people wear them in public. The question is, do you think this has become a permanent part of our future?
I don't think it's a permanent part of our future because I don't think it's sustainable. If it's not, I think people will get sick of it and stop doing it. So I don't think it's going to become a permanent part of the culture just because I don't think our culture will allow it to become permanent. But like right now, I think face masks are a good idea. But the whole point of the face, like it's a respiratory droplet spread virus. So if you protect your nose and your mouth, obviously your eyes, you can get the virus through your eyes too. But if you're protecting, at least your nose and your mouth, you can decrease the risk of you getting it, but you also decrease the risk of giving it to other people, which is why I was wearing the mask, is because I'm seeing patients with probable COVID at work, and I don't want to be walking around as an asymptomatic carrier for 2 weeks, giving it to people, say at the grocery store, because I think that's irresponsible of me. So I'd rather look like a fool than be irresponsible with virus.
Yeah, no, you didn't.
But I think it's a good idea. But I'm seeing lots of people, we can talk more about the mask. I'm seeing lots of people wearing it just over their mouth and not their nose. It's kind of pointless. Or people talk and they pull the mask down over their face because it's weird to talk with a mask on. That kind of ruins the point. You really only need to wear a mask if you're in like a 6-foot bubble of people. If you're, I see people driving down the road in their cars with masks on. That's makes no sense. People walking their dogs in big open fields with masks on, it's not necessary. Really, only if you're going to be in an area where you can get like droplets or breathe in someone else's air, that's where you really want to be wearing a mask. So like work would be a good example, or the grocery store, a good example of places to wear a mask. But if you're in your office alone, no mask.
Right. So. Okay. You think we'll ever be shaking hands again?
I do. I think we'll be shaking hands because, again, it's part of our culture. It's a huge nonverbal form of communication that we have that goes back, decades. People shake their hands, to be polite, to seal a business deal, to greet people. Handshaking is such a part of our culture. I can't see it going away. Now, if you're going to be a handshaker, you need to be a hand washer too. So make sure, if you're going to shake hands, you need to be washing them.
Yeah.
So,
and if you're,
I think we're going to be handshaking this summer. I don't think people are going to be able to get rid of handshaking.
Good. So we have another question.
Personal opinion.
No, absolutely. This whole thing is just your opinion based on your experience because you're out there in the field. So I've got another question. I don't know if you can answer this, but if you can, you can. If you can't, but do you have any ideas or any indication in the community, in the medical community, how soon antibody testing will be readily available?
I think it's going to be like this summer. Now, readily available to the general public, that will probably be a few months after it's readily available to all the healthcare providers, because they're gonna prioritize this when it comes out. Healthcare providers are going to get it first. People who work in residential facilities like nursing homes, behavioral health centers, jails, not the inmates, but like the workers at the jails. Anybody who works, those are going to be your populations that will get it first, because it's important for me I take care of elderly people at work. I take care of small children. I need to know first if I'm a carrier, if I have antibodies, because I don't want to be, listening to a 90-year-old patient's lungs and worry about whether I'm an asymptomatic carrier. So that's why the healthcare workers will get it first, and then the general public. But I think they're close. But I have not heard of them actually having the test yet.
Okay. Okay. Um, so I want to talk about something that is important. Uh, people are in quarantine. I don't even know. I've lost count. Do you have any idea how long it's been? 30 days? I don't know. Anyway, it's been a long time.
Yeah.
And
Every state's different.
Every state is different. People have been quarantined for a while now, and we know that this can have an impact on people's mental health. And so
Yes.
I was wondering if you could speak for a few minutes about how this is impacting people's mental health. How can we tell who's struggling, and what are some things we can do to help mitigate the struggles of people who tend to struggle with depression or anxiety or things like that, and this is just contributing to it. So how can we respond to that as a community?
Well, I think it's important to recognize that depression and anxiety are very normal. It's estimated that 1 in 3 people are going to have some sort of depression or anxiety issue in their lifetime. So I think it's important to realize it's normal to feel like sad when you're isolated. So if it's important that you reach out to the people that you love, lots of text messages, lots of phone calls, reach out, to your neighbors and make sure that nobody's, alone. And I mean, I would ask people, how are you doing emotionally with being cooped up in the house? I actually ask all my patients that when I've been seeing them the last month. Even if I'm seeing them for blood pressure, I'm like, how are you doing being alone, stuck in the house? Because I'm trying to feel out how are they doing mentally. Because this area in Virginia that I live, I've talked to the local law enforcement and they have seen an increase in suicides in this area and an increase in accident fatalities just because people are kind of driving bad on the roads. When people become stressed and scared, they kind of have more poor judgment, which I think is what is feeding into these accident deaths. So, and I'm sure that other places around the country are probably seeing similar, data of people having more depression, anxiety, suicides, that kind of thing. And it's normal. Like we are stressed. This is an unprecedented time. People are having trouble with employment. They're having trouble, not being able to get the things that they need. Being stuck at home. I had a sweet 90-year-old gentleman yesterday, and he was telling me all about how his wife passed away a year ago. So him and I had a nice chat about, his isolation and his loneliness. He's having to deal with the grief of a spouse being gone, and now he's like stuck in his house, and his kids are all far away. So there's a lot of people who are just really struggling with the isolation and the stress of all the mixed messages going on. Fear is what's guiding people's decision making. And anytime you let fear be your main judgment source, your decisions aren't going to be rational. So
yeah, no, that's very true. I've heard it said. I've heard a couple of people. One of them was Andy Latham, who I had on last week, and we had a discussion. One of the things he said, and then I've heard some other people who I don't know, but I kind of follow on social media. They've said, pick up your phone and start going through your contact list and call people that you don't normally talk to, or maybe you come across the name and that person lives alone. Give them a call, shoot them a text, and just like you're doing with patients, just find out how they're doing. I think it's really important. I think I know you do, and I think at this time, there are what would normally be small triggers could be very exaggerated, right?
Sure. Anytime you have stress like this, increased stress on people, and not everybody has great relationships with family members that they're cooped up in their house with either. You're having marriage problems, and now things can get escalated because because of the close quarters and then not being able to go take those mental breaks that you're used to. So I think it's important that you definitely need to reach out to people. I know one thing that John always brags about in the recycling industry that I don't have in my industry is that he always says he feels comfortable just stopping at someone's yard or picking up the phone and calling another recycler. And it's welcomed. The conversation is open and welcomed. You guys have that camaraderie in your industry that I think is very, very rare. And I think you guys should embrace that. Call your other recyclers and check on them. See how your friends are doing. You can't be on an island all by yourself in this. You got to have people around you.
No, that's really, really good advice. I have another question that came in. I'd like you to answer it. I'm not even going to read it. Can you see it?
I can see it. Yeah. I'll let people make that judgment for themselves.
Somebody's a politician. Okay, very good. So I want to ask a couple of questions, workplace questions. And again, I want to remind everybody, I'm just asking for Ruthie's opinion based on her experience in the healthcare industry. So she's certainly not giving any legal advice or anything like that. But so a couple of questions around workplace environment. What are some things that our viewers, what are some things that they can do to keep their employees safe and keep them healthy?
Okay. I would recommend, if people cannot work on top of each other, that's always a good option. Teleworking is always a good option. I had encouraged Jono to not have people, he has a very kind of open office. People come and sit in his office and talk to him. And I kind of encouraged him, you need to have doorway conversations. Don't have people come sit in your office and talk to you. Sit at your desk and then 8 feet away, talk to someone and just have them hang out in the doorway. So you guys have that separation automatically. So doing things like that. I think mask wearing at work is smart. I don't think you need to wear gloves as long as you're washing your hands and not touching your face. Mask wearing is handy just as a reminder to not touch your face and your mouth. I mean, you have to move the mask to touch your nose or your mouth, so it's just a good barrier just as a reminder. But I mean, anytime you can keep people away. The other thing I would recommend is if one of your employees is sick, let them stay home. Don't make them come into work to pick something up. Don't make them go get a note proving they're sick from their healthcare provider. We see this at work where people will be like, I have a fever this morning and my boss wants a doctor's note. It's like, I want to call up the boss and be like, well, gee, thanks. I really needed another sick person to come in to my office to come infect me and infect all these patients, my immunocompromised patients in the waiting room. It's like, if your employee is sick, just believe them. Don't make them get a doctor's note. During a pandemic is not the time to be like Sherlock Holmes about your employee's integrity, about whether they're lying about being sick.
Right.
It's just a time where a lot of those policies and procedures, work notes, stuff like that should just be relaxed a little bit just to kind of protect the community. So if someone says, I have a fever, let them stay home. They have a cough, they need to stay home. And our general rule of thumb for releasing someone to go back to work is that they need to be fully symptom free for 72 hours. No fever, no cough, no body aches, chills, throwing up, any symptom. They need to be fully free of it for 72 hours. That's the rule that we're using where I work.
So I have a question about that because I might have been misinformed, but I had thought, and this is going back a few weeks, one of my daughters had some symptoms. We took her to the doctor. She tested negative for flu and for strep. At the time, they weren't testing otherwise healthy people for COVID. Right. So they sent her home. We quarantined her for 2 weeks, but they said at that time, this is at least 3 weeks ago, they said that that she had to be symptom free for 14 days. And you're saying 72 hours. And so maybe I got some of my facts wrong, but I don't know.
The 72 hours is if the person has coronavirus. They were tested, they were positive.
So they're confirmed.
Let the virus run its course. Then they need to be fully symptom-free for 72 hours before they can return to work. Now, in these unknown cases where it looks like coronavirus, we know it wasn't flu, that kind of thing, then I would still do the 72 hours.
Yeah.
The 14 days is for an exposure.
I gotcha.
You were exposed to it. It takes 14 days for the virus to appear. But if it appears, you go through the course, you need to be well for 72 hours before you go back to work.
Okay. So what should somebody do? Let's say I have an employee who gets sick or exposed. What if they get exposed? I mean, how do you, is there any protocol out there that suggests, like, if I have an employee that comes in and their kid is sick from school, or, well, there's no school anymore, but you know what I mean? If they, somehow it's been introduced to their house,
Sure.
what do you suggest? And again, it's just suggestions.
Sure. Yeah, I actually dealt with this at work yesterday. I had people wanting notes, wanting to know if they could go to work or not because they had an exposure. So I think you need to make sure that the person actually had a real exposure. Lots of people are having exposures that they think were exposures but weren't true exposures. So, and there's this thing, you can actually Google it. It's called the Corona Disease Risk Management and Public Health Management Decision Making. It's an algorithm where you can actually look, and it's a yes or no decision tree, and you can plug in, does this apply to me? Does this, yes or no? And it'll actually puts you in a 4 different categories: high risk, medium risk, low risk, and no identifiable risk. So that's a helpful tool if you're trying to decide, have I been exposed? Should I go to work or not? But if you live with someone who's positive, you work, say, in the same like office within, you've been within 6 feet of someone having a pretty solid conversation of someone who's positive, I would consider that to be an exposure.
Okay.
So, it's a really hard question to answer, because 14 days is a long time for someone to be out of work and to have them just like
right.
be stuck in your house. Like,
no, I get it. I get it.
Away from your kids. That's really, really hard. I get exposed all the time, and that's why I wear my face mask and I wash my hands. So I know I have exposures, but I'm not sick because I have the protective equipment in place. So, so that's why if you can't be exposed, we don't consider it a high risk exposure if you have a mask on or the person has a mask on.
I got
So,
you.
I mean, if someone sneezes in your face and they have COVID-19, you have to be quarantined for 14 days.
Right. Okay.
So, but if you wear a mask, I wouldn't consider it to be a high exposure. So you limit your chance of having to be quarantined for 14 days if you just wear a mask when you go to the grocery store.
Yeah.
So
we see a lot of silliness these days with the use of gloves. People are. Yeah, I mean, you're using your gloves. At some point, it's not any different than your hand, right? Because your glove is touching all the same stuff, and then you pick up your phone or whatever. So people just need to be. I would think, unless you've got a pretty large supply of gloves where you're getting rid of them on a regular basis, it's really a moot point. You should probably stick to hand sanitizer and washing your hands, right?
Yeah, just wash your hands and don't touch your face. You don't need to wear gloves. I actually think it gives people a false sense of security, thinking they can do and touch whatever they want. And then they reach into their purse, they pay with their credit card, they use their phone. I see people using their phone with gloves on, and then they put the phone up to their face. Like, you don't need to wear gloves.
Yeah.
If you're washing your hands. I do not wear gloves, like, when I'm out in the community. Personally,
the probably the one thing that gets inside my head the most is if I go to the store, I wear glasses to read so I can see my phone. But if I'm shopping, I take them off, and then I'm on the cart. I'm holding the cart, right? And then I got to put my glasses back on. And don't you think that I'm very aware that it's happening, and I have, other than washing my hands when I get out of there, I don't know how else to mitigate that.
I mean, I wipe my cart down. I use those little free wipes, and then I wipe my cart down. But I mean, you can see how easy it is to like have cross contact with yourself. Yeah.
And then, so for those of you that might have missed it, part of Ruthie's experience is as a trauma nurse in the Navy. And I was having a conversation with a friend of mine this past weekend, we were discussing the Roosevelt and the outbreak there, and he pointed out there is no, every surface is a common surface on a ship, and so it's just a bad environment to try to contain something like that. So just to your point about, once you really start examining, even outside of that environment, in our environment, you start looking at all the different ways you touch stuff and then touch your, I mean, I don't ever think about it until we were talking and you said, just don't touch your face. And now my nose itches immediately. Like I don't know what it is, but it happens every time I go in public. So, look, I really appreciate you taking time. If anybody has a question, please chime in. We're going to wrap this up. And Ruthie, if there's anything else, is there anything else that you would like to say that I haven't asked you about? Otherwise, we're going to wrap this up.
I think the biggest thing that I want people to take away is to not be just overcome with fear and making emotional fear-based decisions with all of this. I mean, we need to have, we need to take care of ourselves, do the best you can, be smart about going out into the community, only do it when you need to, and just be careful and don't believe everything you hear or read. There's a lot of misinformation out there that can cause you to be fearful and panic. So just be rational in your thought and don't have fear be one of your big motivating decision factors.
Right. No, that's good advice. So I want to remind everybody that last week you should have received the current Automotive Recycling magazine in the mail. There's a lot of good articles, but particularly there's an article, wait, wrong page. There's an article in there by Sandy Blaylock about, has a lot of good information in it about working in this environment, a lot of good references and websites you can go and visit to get that help give advice on this topic as well. And honestly, if you haven't read through this, you really need to. There's a ton of really great articles in there. And if hopefully you don't have to run to your mailbox and get it, because that'll wear you out. So anyway, I want to thank you, Ruthie, for taking time to do this. I want to thank everybody who's watching. Thank you for the comments and questions. I'm really overwhelmed by all the people. I get lots of emails and text messages and Facebook messages about these discussions, and it's very encouraging. I appreciate it. If you have a thought or an idea of a topic, please reach out to me, and we'll see what we can do about it. If you have any suggestions on what we can do better, love to hear from you. Thank you guys. Thank you, Ruthie. You guys have a great day, and we'll see you next time. Oh, before I go, I want to remind everybody that next week on Tuesday we will be having our virtual town hall, and so that will be on Tuesday at 2 o'clock. So please tune in for that. You're gonna hear from the executive committee as they update the industry on a number of different issues, and we're gonna have some information about our the ARA COVID-19 Relief Fund. So we're very excited about talking about that and all the other things. So thank you guys very much, and you guys stay safe and have a great day.
Bye.